Greetings from Geneva, Switzerland. In 1 minute and 8 seconds, we'll be kicking off the 14th and final weekly assembly of the full learning cycle of the Movement for Immunization Agenda 2030. 14 times we have come together around the shared purpose of improving immunization, accelerating progress towards the goals of the World Strategy for Immunization, Immunization Agenda 2030. In just 42 seconds now, we'll be coming together with leaders of the Movement for Immunization Agenda 2030 to hear what they have been up to and how they see the future of immunization, but also the future of this movement. Greetings from Geneva, Switzerland. I'm Reda Sadki. And warm welcome to you, whether you are returning for the 14th assembly or whether this is your first. Whoever you are, wherever you are, warm welcome to you. We're here because we're concerned about the future of immunization. And we'll be telling you more about that in this 14th assembly of the first full learning cycle for IA 2030. But first, I want to revisit what we did together Friday. What a wonderful, incredibly intense moment of communion, of breaking bread with thousands of immunization professionals from all over the world. It's called Teach to Reach Connect. And it's a unique networking event, a unique opportunity to meet, network, and learn. I'm very pleased to announce that Teach to Reach 7 is now up. You can already request your invitation, and pleased to announce that the date for Teach to Reach 7 has now been set. It will be Friday, October 14th in the afternoon, of course, Geneva time. The time may be different for you. And now to come back to what is happening on Wednesday and Thursday. For those of you who were at Teach to Reach, you already know about this. For those of you who are joining us now, weren't able to make it, with UNICEF, Gavi, USAID, the IFRC, the World Health Organization, and the Geneva Learning Foundation. UNICEF is organizing a global event on COVID-19 vaccine demand, and all Teach to Reach participants are invited to join this COVID-19 vaccine demand global event that is taking place on Wednesday and Thursday. If you were at Teach to Reach and if you registered in the correct way on the Learning.Foundation website, you should have received your invitation. Check your spam. Make sure that our emails are not ending up there. That's quite important. Now, remember why we came together. And the premise you see before you. In most countries, there's a saying like this: if you want to walk far, walk together. And we're here 16 weeks later because on 7th of March, over 6,000 health professionals from 110 countries made a commitment. And that was a commitment to contribute to a global movement for Immunization Agenda 2030. So I'm now going to turn to you in the room. If you're still here after 16 weeks, consider yourself a leader of the Movement for Immunization Agenda 2030. Now we'll talk about what that leadership means, and I invite you to reflect already on how do you see yourself as a leader for the movement? What does that mean? What does it call for you to do? But I'd like to ask you these 3 questions, and you can see them on your screen now. If you're on your phone, take a look. I'm also pasting them in the chat for those who have problems with the video. So here are the questions. Don't forget to introduce yourself. Raise your hand if you want to, if you're ready to answer these. Tell us when you joined the movement. That's a kind of preamble. Question 1, should this movement continue? You have been part of it, whether you just joined today or whether you've been there for the full 16 weeks. You tell us. You tell your peers, your colleagues, do you believe this movement needs to continue? Why or why not? Second question, how many health professionals are there in your country? And how many are already active in the movement? From vaccination coverage, you know the numerator over the denominator tells you percentage coverage. So what is the percentage coverage for the movement right now in your country? Do you know? And whatever it may be, What do you plan to do to help the movement grow in your country? If there is room for growth, if every health professional in your country is already active in the movement, then your job is done. It's about everyone has come together. But if not, as a leader, being a leader could mean helping the movement grow in your country. So who would like to kick off? Who's going to be our first speaker? Let's see if we can go to Samuel, who actually responded in the... okay, and I see Melese Teferi. Melese, you've been a frequent interlocutor speaker in our sessions. Ahmed Niama from Iraq as well. Would love to hear from... let's go to Melese first, and then to Ahmed, and then to Samuel Jack Rees. Let me remind you, however, of the rules for fairness on speaking in the IA 2030 movement. So, Melese, please don't forget to remind us who you are, what you do, when you joined the movement, and then you have the 3 questions before you.
Okay, thank you, Rada, for giving me the chance to just share my intention and just to reflect about the moment, whether it's need to be continued or not. I'm really happy to be this moment. I'm actually Melese from Ethiopia, Addis Ababa. I'm working in a research organization under the Ministry of Health. I'm just working in a research environment, which really focused on infectious disease. And I'm currently a co-investigator for vaccine effectiveness study for vaccines that are already used for COVID in Ethiopia. So, could you hear me?
Yes, we hear you loud and clear. Should this movement continue? Why or why not?
Yeah, I need this moment to be continued because there may be professionals to be joined through time and share experience from different professionals in the globe. That may be good to see their situations, to see their challenges, and develop solutions from experiencing other immunization professionals. So to get experience from different professionals, it's very important place. It's very important place to
very well. So second question for you, Melese. Do you know how many health professionals altogether there are in Ethiopia?
Actually, at the beginning of this moment, there are actually around 17 professionals involved in this moment. Through time...
but I mean, how many altogether in Ethiopia? Do you know how many health workers, doctors, nurses, midwives are there in your country?
For this moment or all over, do you mean?
All over.
Yeah, actually there are huge professionals in Ethiopia.
Yes.
I'm not sure actually the actual number, but there's huge professionals in different categories. But for me, to join this moment is very important, but still we are not just doing the expected level, but through time it may be true that professionals will join us and learn from these experiences.
So Melese, if you consider yourself a leader in this movement, what do you plan to do to help the movement grow in Ethiopia?
Yeah, actually, individuals need some testimonial from the one who just introduced new platforms, new information. So I will be a witness for them that I'm benefited from this platform, that I learned a lot, and try to inform, try to convince them to join and try to help our country by improving the immunization status populations that already are affected by different communicable diseases. Yeah.
Okay. Wonderful. Thank you, Melese Teferi. Let's go to Ahmed Niama. Ahmed, you're calling in from Iraq. We'll hear you on these 3 questions. Don't forget to introduce yourself and remind us when you joined.
Hello, Rada. I am Dr. Ahmed Niama. I am a health field officer in the International Committee of Red Cross based in Iraq. I joined this movement in March the 7th. At the beginning, I applied for the situation analysis and I participated in the IDEA platform. And as you see, I have completed also the responsive feedback and action accelerator.
Yes, indeed.
For the first question, yes, of course. I am in favor of this movement to continue and to have kind of sustainability, because now we are over 6,000 colleagues and health professionals all around the world. It will be much helpful and of an added value if all we connected and work together for the promotion of immunization and health. For, as you may notice, that I'm the only participant in Iraq, and that's why I am thinking about sustainability of this movement on for future projects for this learning cycle, because for some countries, like, this is a new thing. This is a new wave of learning and promotion, and I faces some challenges, and especially for like our busy colleagues to participate. But I'm still on the track, and I'll try to encourage them to participate.
Wonderful, Ahmed Niyama from Iraq. Thank you for this contribution. Now let's go to Samuel Jack Rees. Samuel Jack Rees.
Good day. I am Samuel Jack Rees.
Yes,
Can you hear me there?
Yes, loud and clear. Do introduce yourself. Yeah. Tell us when you joined the movement, and then you can take on the 3 questions.
My name is Samuel Jack Rees, an environmental health officer and also a disease surveillance and notification officer in Rivers State. I joined this movement precisely last year in the first cohort, and based on commitments. At a point, I lost my focus and rejoined 3 months ago this year, and I've been following up till this moment. The first question, my answer is I would like the movement to continue. And the reason is because this movement has made a lot of us who are in the health profession improve our knowledge, our ideas, our skills in tackling health issues, especially that of immunization. And many people now have gotten the conviction that immunization is something that will definitely improve the health of the population, that will improve immunity, that will help to defend against disease infection. Presently, now that the pandemic is a challenge, COVID-19 vaccines are now demanded more than before by a lot of vaccinees, especially in Rivers State that I know, and Nigeria as a whole. Globally too, that is what is obtainable. So I really need John. How many health professionals are there in my country? In my country, I may not more than 74,543 medical doctors. And we also have 92 nurses per 100,000 population. We have 64 community health extension workers per 100,000 population, and so many other health professionals according to their area of specialization. So we have a lot of them who are willing to improve their knowledge in health practice, especially public health practice, so that the masses can enjoy better health in their various communities. And for the third question, what do I plan to do to help the movement grow? Of course, based on our action plan that we have already put in place and we are trying to follow up. Of course, the action plan will be followed up to the letter, and we ensure that the plan is implemented and our plan will be brought to a reasonable outcome where our goals, our targets will be achieved, and we'll have the outcome being beneficial to the community and to the public in our state and our country at large. So thank you very much. I wish the movement continue beyond this state. Thank you very much.
Thank you very much indeed. Let's go now to Olivia Aboagie. Olivia,
Hello.
are you able to speak to us?
Hello, good afternoon, good morning, good evening. I'm Olivia from Ghana, working with the service as public health officer, health promotion. In fact, I agree with the motion that the movement should continue because it has helped us. Some of us, it has helped us. It has built our skills. It has built our confidence. It has given us more ideas as to how to tackle challenges that affect our work. And so I prefer the movement to continue so that it will continue to help us to implement most of our activities to improve the health of the people. And then the second question, this country we have maybe 6,000, 7,000, in fact, professional health professionals, we are many. But I think those that are on board will not be even more to up to 1%. Up to 1%. So what I will do is that I will try to convince most of my colleagues, those that I have contact with, and those that I can share the movement, the importance of the movement, and how it has helped us. That is what I'll be doing. That's the question 3. I'll create awareness about the movement, all things that is being done, the skills that we are acquiring, the knowledge that is being built for us, and then our confidence. And so I will encourage others to also come and join so that this country, we can also come together and improve the health of children and then women. So thank you.
Thank you very much indeed, Olivia. Now, I believe having listened to several speakers now, I believe that each and every one of you is underestimating the significance and potential of your leadership. If you are still standing after 16 grueling weeks of activities on top of the daily work of immunization that you do, that makes you truly exceptional. You can be proud that you have withstood the test of time, the many challenges that you're facing, that you've made it this far. But now the true challenge of a leader, others are going to look at you. And I believe experience has shown from the past that people who participate in our programs come back to us and say, I secured a promotion from my professional work. I got a better job. I moved on, and I improved. My colleagues now look at me as a model. They don't understand how I know so much, and I'm able to do more than I could ever do before. And they attribute that to their participation in the movement. But at the same time, even if you impress your colleagues, and some of them will say, okay, well, I will join because this sounds like a good deal. You are not like most of your colleagues. You have something special about you that starts with your intrinsic motivation. You found motivation within to join this movement, and not only join, because more than 8,000 joined, but to actually make it to the finish line today. And that is truly exceptional. But being exceptional means you cannot assume that what works for you, what motivated you, will motivate others. And so the challenge of a leader, we'll come back to that at the end of a session. I'll challenge you to think about, what does it mean for you to be a leader of the IA 2030 movement? If most people who should be joining, who stand to benefit, who are needed if we are truly going to accelerate progress towards the goals of IA 2030, they're not going to be moved by the same kind of things that motivated you to join and sustain your effort. And that is the real leadership challenge when it comes to getting others to join the movement. It's very impressive that you have been able, and it's already in some ways a large number, thousands who have joined, thousands who've participated in the activities, thousands who have, when you add it all up, the ideas engine plus the action plans plus the accelerator, thousands of people who've participated in the activities. But that is a drop in the bucket compared to the number of health professionals who, if this movement is going to truly make a dent, need to come together. And you cannot make the mistake of assuming that others will get moving, will join or sustain their commitment for the same reasons that you have. And in fact, I wanted to just, before we come back to listening to your voices, I wanted to run through what exactly it is we did and why, and encourage you to think about those three questions and think about what does it mean for you to be a leader, because we can legitimately consider you to be a leader in this movement. So we started, and this, for those of you who were there on Friday, you may have seen this in Teach to Reach. The numbers have not changed. 45,641 people that we can reach through the Geneva Learning Foundation's immunization platform. And what we focus on is actually helping you create, build, sustain connections with others, as well as, hopefully have a healthy relationship with you. Now, when it comes to this movement, this comes from, the call for this movement came from the World Health Assembly. So if you are a health professional, this is the highest body for health. There is no higher place for calling for a call like this to come. It is a legitimate call. It came from the Director General of the World Health Organization for a strategy immunization agenda that was adopted unanimously by your country, by every country. Now, part of IA 2030 is that, and part of our view as well, is that your commitment, the commitment that you've shown by sticking with it for 16 weeks, and not everybody made it to the finish line. You know this. Your commitment can make a difference. And increasingly, there's recognition that it's at the local level of immunization that the difference is made. And that is why every person, whatever part of the health system you work at, whatever your role, status, pay, matters. But you are the key to leading the change. So when we kicked off the full learning cycle on 7th of March, and we said we'll accompany you, we'll walk side by side with you from knowledge acquisition, which is knowing more is necessary, nourishing yourself, informing yourself from the best available global resources, global knowledge from WHO, from UNICEF, from Gavi, from reliable sources of information is critical, but it's no longer sufficient to go from knowledge to impact. And so 16 weeks later, remember we asked you this question, do you face any of these challenges? And most of you do. Think about, has anything changed with respect to your most urgent challenges? You need to do that reality check. If it hasn't, despite your participation in the movement, then maybe you need to ask yourself, is this worth it? Is this movement actually helping you? Because it's not about feeling good by being together. It's about feeling good so we come together to support each other to actually make that difference. And as you know, 8,377 said, took up, responded to the call of the movement, committed to holding up, to honoring the Scholar Pledge. And after 16 weeks, this was actually for Friday's event, but the movement completes the first full learning cycle. And so I'd like to quickly remind you what you did go through and take stock. Think about it. This is impressive. A 16-week learning program, and you made it. You succeeded. You were successful going through this program. Here is a recap of what we did. We started with the ideas engine. Almost 1,000 ideas in the first few days of the movement. We then followed up with situation analysis. 4 weeks where you first developed your own situation analysis to uncover the root cause of your challenge, but then you also supported your colleagues by peer reviewing their situation analyses. And together you produced 664 situation analyses. And almost half of you uncovered a root cause that was different from what you thought it would initially be. Many of you enjoyed, but also found productive, being twinned with other scholars, other members of the movement. after the World Immunization Week event, which is actually missing from this slide deck, in the 9th to 20th of May, we kicked off the Action Plan Hackathon. And in 2 weeks this time, more than 1,000 action plans were developed. We then asked you a simple question: are you ready to take action? And we kicked off what we call the Launchpad. And 4,149 said, yes, I'm ready for the Impact Accelerator. You'll notice that this is 4 times bigger than the number of people who actually did action plans. I will come back to that. And then I was special mention to the experience sharing sessions. Not everyone joined on Tuesdays or Thursdays. Not everyone was able to join, certainly every time. But a very amazing takeaways, lessons, insights. Charlotte and Boo and François Gass are actually working on a synthesis, on a short document, a summary document, so you can get all the lessons learned, even if you didn't make any of the sessions. So that's what we did together, and that's certainly worth a little bit more applause. Now, we have more hands raised, and going to go to Nelson Mandela Alberts. Now, remember the rules, and please try to honor them. The rules for fairness and speaking in the movements. So let's go. Yes, Nelson Mandela Alberts, the floor is yours. You have 3 questions before you. You can also tell us what you are feeling right now about what we just shared. 16 weeks of sometimes grueling, always intense, a sharing of experience, and just intense effort to make progress against your challenge. How are you doing?
Yeah, thank you for giving me this opportunity, Mr. Instructor. I am very grateful for being admitted for this session. Indeed, it has been wonderful. I would like just to respond to the first question that should this movement continue. Of course, my standing point is that yes, this movement should continue so that we are able to ensure that all the issues of sickness that are within, or the issues of immunizations that sometimes may not be put in place should come into normality. So regarding the second question, that how many healthy professionals are there in your country? Of course, in this context, I will not be able to estimate the number of professionals. I only know about the number of healthy workers that are around within the facilities that I know I'm able to coordinate with them. There are about 21 healthy workers. Then the third question, that what did you plan to do to help the movement grow in your country? In regard to this, I would like to ensure that in time we'll be able to convince the members around, rather the community that we are engaging with, to at least understand that immunization to children are more vital. So as well as also conducting community outreach to hard to reach locations that would not be accessible. So it is I beg to stop here. Thank you.
Thank you, Nelson Mandela Albert, for this contribution. Now we'll go to Obasi Oruwigo Ufuoma.
Okay, thank you. Thank you, Reda. Okay, pharmacist Ufoma Gloria Obasi Oruwigo from Enugu State, Nigeria. I joined the movement March this year, when it started at March 7th. And I would say that I want this program to continue, the movement to continue, because it has actually, it has in itself equipped me with information that I didn't really know about the vaccine preventable diseases. And I would say most of us who are health professionals, we only do some of the courses theoretically in colleges and all of that. But then for the practical answers to most of these vaccines preventable diseases, we have little or no knowledge of them. And if this movement should continue, at least more persons, more health professionals, we have this evidence-based, we have this evidence to back up the claims on the safety and effectiveness of these vaccines. And then the second question is, how many health professionals are there in your country? And how many are already active in the movement? Okay, for Nigeria is a very big country with over 36 states. And the health professionals, which from pharmacists to medical doctors, nurses, and all the other health professions, I won't be able to say categorically the numbers of health professionals, but I know that they are running into hundreds of thousands of, if we should have a cumulative of them. And then for how many are really already active in the movement, in our scholar group, the Nigerian scholar group, we have over 500 and something fellows that are actually active. So of which, if you are to take the percentage of that with the hundreds of thousands of health professionals in Nigeria, you can see that it's even less than 2% of the total population we have. So that's one of the reasons I really want the movement to continue. Then for the third question, how do you plan to help the movement grow in your country? One of the things I intend doing, like the health facilities that I worked with during the situation analysis and my action plan, I've collected the numbers of most of the immunization staff. So I intend telling them about the movement and then sharing the link of the movement to them and encouraging them to join the movement so that they can actually open up in terms of talking about the challenges and solutions to some of the things challenges they encounter during their routine immunization. And also, outside that, we in Nigeria, we have this young pharmacist group where all the pharmacist professionals in Nigeria are all linked up in a social media platform. So one of the things I also will do to support this movement is that I will also share the link of the movement to them, because we have over more than how many thousands of health professionals, young pharmacists coming together in that platform. And then I will share to the group and encourage them, as many as possible, to join, and other members of the health professions that I know on a personal note, so that in a way we can have a conglomerate of individuals interested in securing public health and making sure that we have a safer and a longer life for the population of the world. So, for all of this is all I have to say. Thank you, Reda.
Thank you very much indeed. Wonderful to hear this, to hear what you're sharing. And again, I'd like to encourage you and all of us to think about, if you have become a leader for this movement, and most of your colleagues are not like you. They're not going to have that motivation that comes from within, that comes from, and you decided to join and commit and stick with it because you wanted to. But what can you do to help people who are not going to be as motivated as you are, and show them that this is in their interest, that this is to their benefit and to the benefit of the health of the children, families, men, women, boys, and girls that they serve as health professionals. For Chinyere Nwosu, who asks if there is any group for the scholars in Nigeria. Yes, indeed. So Chinyere, I'm guessing you have recently joined. There is a very large and active Nigerian community. It is the second largest is from the Democratic Republic of Congo. They're currently, of the 45,000 people on the platform, more than 10,000 of them, so more than a quarter, are Nigerians. There is great potential there. Now, going from that potential to actually organizing a country team that meets on a regular basis, that has a clear shared purpose, that agrees on how to function and work together, that is the hard work that some of the Nigerian leaders in the Nigerian scholar community have taken on and are pushing forward. So I encourage you, Chinyere, to connect with them, to connect and to see how you can contribute as well. So thank you, Obasi Orovigwo Ufuoma. We're now going to go to, I would like to hear from Asia. I believe we can try Dr. Kaushik Nag, who has been a frequent contributor. Dr. Kaushik.
Hi, good evening, sir. I am Dr. Kaushik from Tripura Medical College, Faculty Community Medicine. Definitely this movement should continue because this is a movement which connect experts or healthcare workers who are working in the field of immunization, and it improves knowledge. We can learn lots of things by sharing our knowledge. Also, we can identify our barriers in immunization, and also simultaneously we can do situation analysis, and by responsive feedback we can improve our immunization coverage. So I am not sure about how many health professions are there. I hope it is more than 100 in this moment, and previously also there were lots of experts from our country, and it was last Friday was very good program. I had a very nice experience. And the last question is, what do you plan? The plan is, as I already mentioned, my challenge was fear of AFI among the population I work. So for that I started training my interns and healthcare workers on AFI. And next plan is to do periodic health awareness campaign or health education session in the community level, so that I can reduce the fear of AFI. Also, some myths are there which I can reduce, and so that I can improve the immunization coverage in my area, that is Tripura. And thank you, Reda sir and Charlotte and all who are involved, especially the scholars of Geneva Learning Foundation, for giving this wonderful opportunity to learn together. And hopefully we can win this battle and we can improve immunization coverage all over the world. Thank you.
Thank you very much indeed, Dr. Kaushik Nag. Now, here's what's coming next. And for those of you who were there Friday, the first thing I said, and that I will repeat, is what you're going to hear are the kinds of things we're considering. You will all, as leaders of the movement for Immunization Agenda 2030, receive the invitation to join the discussion, the dialogue, to co-create what exactly the next steps will be. Now, the first practical aspect is about certification. So this is a reminder of the certification requirements for the Impact Accelerator. So one is submit your IA 2030 action plan. Second, we ask you to set a specific goal you would achieve by the 17th of June. And then 3 is actually several actions. So between on the 23rd, 30th, 6th, and 13th, so basically on successive Mondays, we ask you to fix one action. And this actually required submitting a short form with 2 questions. And then every Friday during the Launchpad, we ask you to share your progress. So in order to earn certification for the Impact Accelerator, you need to have shared one action 4 times and then one report 4 times, Mondays and Fridays. And then there'll be one last step. As you can see, this final stage of the full learning cycle has the most stringent requirements. So that means, and then there's one final report, which will be available next Monday, which will be the final acceleration report. So this is where you'll get to tell us and document what progress you have actually made. Remember, we worked on a weekly basis. So now on the 27th of June, we'll be asking you, so did you achieve your specific goal? What progress did you make with stakeholders, with funding, with every other aspect and consideration? Now, the other question is, what happens after the Launchpad? Now, if you remember, 4,149 people said they wanted to do the Impact Accelerator, but actually only 1,021 people submitted an action plan. So we are extending the deadline to submit your IA 2030 action plan. If you are in the room either, and also there have been more than 2,000 people who've joined the movement since kicking off the action plan hackathon. So we are extending the deadline. You'll be able to submit your IA 2030 action plan. We'll reshare the guidance. There will be no experience sharing sessions or Monday assemblies. That's very important to understand during this period. But anyone who wishes to submit their action plan and earn the certification to recognize that they did an action plan can do so, and then you have until August 27th. Now, if you already submitted a plan, you do not need to do it again, because that's always a question for the most diligent participants. And then a month after your action plan, we'll ask you to submit your acceleration report so that you can, and that will earn you the final level of certification in the full learning cycle. Now, we'll also be inviting all movement members who are actively working on implementation of their action plans to continue to share at any time you see fit your successes, lessons learned, and challenges. And then we'll be sharing those, so those not every time, not continuously, but we make the commitment that we will share these back with you so that you can learn from each other in that respect. So that is the first two announcements. The third one is about the governance of the IA 2030 movement. So any movement needs a structure, some structure, even an open movement like this that anyone can join. And so what we're considering and what we'll take up in the discussion and the dialogue with you to actually build something that is fit for purpose, that will make sense to you and to every member of the movement. First, very important component is to make sure the movement is integrated with the national EPI team, so that in every country where we can reach, we have alumni who are part of the national teams, to make sure to collaborate and coordinate with them so they understand. IA 2030 has, it was the ministers of health who were in Geneva 2 years ago and who adopted IA 2030. So no Ministry of Health, no national EPI team can say, this is not for us. The country has already made the commitment, but the practical collaboration and coordination is something that we'll be working on in the coming months. Second, as leaders of the IA 2030 movement, you remember we asked you to, if you were interested in becoming country focal points or regional focal points. Now, for some regions, we ended up with 200 people who said, I would like to be the regional focal point, and 120 people who said they would like to be the country focal point. So we now know who are the leaders who have made it this far, who've been able to sustain the effort. And so we'll be going through a process through which candidates, leaders who wish to become country focal points or regional focal points will be able to nominate themselves, introduce themselves, because obviously we're talking about a global movement where it is very unlikely that you are going to know about the candidates and their work, and then we'll be organizing an actual vote by country and region. Now, this is formulated a little bit differently from the way you probably heard it on Friday from our Insights unit, from Ian Steed and Ian Jones. For those of you who joined, they had a special workshop explaining the process for how you can become a contributor, an author, a reviewer for the products that are being assembled by the Insights unit. So increasingly, the way I was thinking about it today, putting this slide deck together, it's more like an editorial team or editorial board. So we'll be sharing more about that for those of you we'll be sharing the recording of the Friday workshop so that you can make up your own mind about whether this is something you want to be involved with. And then the upcoming milestones, or the sort of broad outline of the calendar of the things we're considering doing. And again, let me emphasize, this is not a commitment to do all of the things that you see here, but this is where, in our current state of thinking, we think might be constructive steps. We don't want to have a discussion with a blank slate, because we know from the past, from experience, what works better and what doesn't work so well. You can see here the upcoming milestones from September to December, a series of short peer learning exercises, so not a 16-week full learning cycle. The structuring of the coordination and the movement's country focal points. inter-country experience sharing, similar to what we did with the COVID-19 vaccine introduction when there were some very, very interesting exchanges between countries. So we hope to foster and encourage more of that. Teacher Reach Connect 7, the date is now set to October 14th, 2022. We'll be asking you for an acceleration report to tell us how are you doing with the implementation of your IA 2030 action plan? How far have you gotten? What has worked? What hasn't worked? And again, the point is to then share recipes and ideas and practices with each other. January 2023 will launch the second call of the movement, and that is likely to be another very long questionnaire. But by then, my hope is that you will have seen the work produced by the Insights Unit, those of you who wish to contribute to it, to help review, edit, think through, feedback on it, will be able to do so that this second call to the movement will be owned by everyone, and that you'll also be able to get something back after answering the many questions we will undoubtedly ask you. And then the next logical sequence would be from March to June again to run the second full learning cycle. So that is what we have laid out. I want to go back to the questions. We still have 16 minutes. I know I went very quickly. You can always review the recording at the usual place on our YouTube channel. Or if you have poor connectivity, you can subscribe to the podcast. I'm going to share both links right now. And then back to you. We have many hands raised. I'm going to try to remember who had already spoken. Let's go to Gifty, Akusoa, Adzigbe. Gifty, the floor is yours. All right, Gifty is not unmuting. Let me try Mary Vanderpuy.
Hello.
Yes, Gifty. A warm welcome to you.
Hello.
So you have 3 questions on your screen. Oh, I think Gifty is not able to hear us. Let's go to Mary Vanderpuy. Yeah, unfortunately, Gifty is not going to.
Hello.
All right, let's go to Mary Vanderpuy. Mary?
Hello, Reda.
Yes, we hear you.
Good afternoon, good evening, good morning, wherever you find ourselves.
Very well, thank you.
I'm Mary Vanderpuy. Mary Vanderpuy from Ghana, a public health nurse as well as a nurse practitioner and a nurse prescriber as well. And from March till now, I've learned a lot from this movement. I've been able to build my capacity towards immunization achievements and how best we can do to help us get our coverages and help other people to also improve on their immunization coverage. So for me, I would say we should continue with this movement and we should encourage other people to come on board as well so that we can all together achieve the overall goal towards immunization. With number of health professionals in my country at the moment, I don't know the exact number in Ghana, but I know we have a majority of percentage of health professionals in Ghana. And as to the number of people who are in the movement, we are quite few. So the best thing I will do is to sell this movement out to other people at my workplaces, wherever I find them, other organization and WhatsApp groups I am in. I will just lobby and I will just advertise this movement and encourage people to come on board so that together we can help this movement achieve its purpose. So what to do to plan to help your movement in your country? Once we have the WhatsApp, the Telegram group for our country, I think we will continue with our meetings and our discussion over there. And from there, we will take it on as to how to help our country as well to broaden its coverages and how best we can help achieve our immunization target. Thank you very much. And I'm so grateful for being part of this movement. Thank you.
Thank you very much indeed, Mary. Let's try Gifty again. So Gifty, the problem was not that we couldn't hear you, it was that you could not hear us, but that may be hard to tell which one it is. And I believe that will tip us over on the wrong side of our rules for fairness on speaking in the movement. Let me just post them as a reminder here. So Gifty, you need to unmute yourself, but I believe we need to leave Ghana and go to... Yes, Gifty, can you hear us now?
Hello.
Are you able to hear us now, Gifty?
Hello. Yes, please. I can hear you.
Okay, the floor is now yours.
Okay. So, good morning, good afternoon, good evening, everyone. Wow, it's been great being part of this movement. I'm Gifty Akosia Jibe. I'm a public health nurse in Apam, Goma West District in Ghana. And I joined this movement from day one in March, and it has been so helpful. So for the first question, I would say that yes, I have learned a lot, and I want the movement to be sustained so that most people can also benefit, because the strategies that were used, such as the engine, the ideas engine, the experience sharing, listening to women who deliver vaccine, how to build confidence in COVID-19 has really helped me. That's really encouraged me to work selflessly. Yes. Then also for the number 2, I would say that I can't actually tell how many people. I mean, like us in the total number of professionals in Ghana, I can't actually tell. And those who have joined the movement, because I'm new, I would say I don't have the total number of people that actually joined the movement. Yes, I might not give you the actual figure. Yes, but I know most of them have even joined. Not all of us have been able to complete that. I know most were not able to. Then for the third one, I would say that what I've planned to do to keep this movement going, first of all, I decided to share the movement with other new staffs. Yes, I first of all share with some staffs. Some were able to join, some were not able to continue the race with us, so they fell out. No problem. But I will keep on sharing the movement with other new staffs in my country. And then also, I will also share my experiences and then the benefit that it will bring to our work, being it in our facilities, being it in the districts, being it national. I will share with them, because an example is the efforts that women who deliver vaccine put in. In fact, I was so much encouraged when I listened to them. How to build confidence in COVID-19 vaccine had also really helped. And so we're able to even improve upon our risk communication strategies in Ghana. And I would say that most people have really turned out for the vaccine. Then also women's health, that is female genital trichomoniasis. If not for this program, frankly speaking, I've never heard about this program, this project. So women are still in their own way trying to put in all their best to be able to help women with their health. I've realized that, yes, I've really learned a lot, and I'm even sharing that information with other people in the country. And I'm hoping that, I think the other time I placed a comment that if I'll be given the privilege to be trained, I'll be very grateful that I'll go far and near to educate more women in the villages in the interior, because they are also near to some water or river banks that are in their areas that are not clean, but that is where they feed from. That is what they drink. I'll be grateful if I'm given that training, or to be empowered to be able to train other people. Then also, my next point, to keep the movement going, I would say that I'm determined as a woman, because I'm also a woman who deliver vaccine, to put in all my efforts that I'll not leave any child behind, especially people with speech and hearing impaired. Being it far and near, I am determined to take the movement to do more for my country. Yes. Thank you. Thank you, everyone.
Thank you, Gifty. And this applause is for everyone who has shared their responses, their thoughts. I can hear, and I'm sure you can too, hear the will, the determination, the force of conviction that has led you to participate to the extent that you have. Now, remember, however, that the challenge for you as a leader is to recognize that most people are not going to be motivated in the way that you are. Most people are not going to commit as much as you are. So the question is, how do you get most people, your colleagues who you've talked to them, but so far they haven't participated, they haven't joined. It's your role, your real role as a leader is, of course, to lead by example, but it's also to think through what is going to make it work for your colleagues, and to let us know as well. That's part of why we will be organizing these co-design, co-creation sessions together as we go. Now we have 7 minutes left. I remind you, so if you are from Ghana or Nigeria, please, I need to ask you to lower your hand so that we may hear movement members from other countries. Let me see. Let's go to Suresh Shukla. Is Suresh? Okay, no. Yes, Suresh. Sometimes it's hard to tell by name. Suresh, please do introduce yourself and let us.
Sure. Thank you.
Yes.
Thank you. Thank you, Dr. Reddy and Geneva Learning Foundation team. I'm Dr. Suresh Kumar Shukla, working as Surveillance Medical Officer in WHO Nepal IPD department since 2 years. And I joined this Geneva Learning Foundation Immunization Agenda last year, 13th September. And should I this movement, of course, want to continue because I joined movement in this. The movement should continue because it has been a hub for experience sharing and has enhanced by knowledge and the skill. We can learn a lot of things from this platform, and we can also share our skill to others. So I am very interested to continue. Another things, I have been in my country more than approximately 60,000 health professionals, but almost only 100 professionals are joined with this platform. My plan to do help in the movement, like I have been sharing in the health group, like as a surveillance medical officer, we have the network with all remote area, VDC and city and private hospital, government hospital, especially with the health worker network. So we are sharing by WhatsApp group, Viper group to come and grow your knowledge, skills, and it of course help to grow our country movement in the respect of immunization. And of course, still our country and suffering from the achieving the proper target and coverage of the COVID vaccination or routine immunization. Our purpose to, of course, catch up all the at least 0-dose children, no one 0 children left in the community. So at my experience, I will try my best to continue my time in the expand our skills and make more people network with the global foundation with Immunization Agenda 2030. Thank you so much. Give this platform, Dr. Reddy and Global Foundation team. Thank you so much. I'm from Nepal. Thank you, sir.
Thank you very much indeed, Dr. Suresh Shukla, for this contribution. Hassan Benya, the floor is yours. You will be, I believe, our last speaker for today for the last assembly of the first full learning cycle.
Yeah, thank you very much, Dr. Reid, for giving me this opportunity. I think for Sierra Leone, definitely, I'm still trying to see how best we can get a lot of our colleagues. Back to the point, I think the movement has helped me a lot. I think my first time of joining the movement was in March, this 2022. So as a result of that, I was able to really understand the exact point, the exact drive for this particular movement. And as of today, I can tell you that I was able to really develop my own action plan. And as of today, I've actually been able to really engage the key stakeholders around that. So that tells you that it is very, very much important for me for us to continue this particular movement. And I think one thing I really learned about this movement is the feedback, the responsive feedback. Looking at the responsive feedback, it can give you a clear guidelines of who to meet in terms of leadership and who to connect with, when to share your information. That was able really to help me to be able to talk to the leadership at national level for me to start my project implementation. Although I could not actually meet the June 17, which was the time for us to do a presentation. That particular thing was a good movement. So that tells you that it is important for us to continue. Then in terms of the healthcare workers, Sierra Leone currently, we have about 8,000 healthcare workers, and there is plan also to add more healthcare workers, although we have limited doctors across. Then how many active? So definitely that one is one of the biggest challenge. In terms of the active members, I've been able, I work directly with the EPI, program, the immunization unit. So I've been able to push them several times for them to really participate, starting from the leadership down to the list personnel. So of course, it's also work in progress. So I think my projects currently I'm embarking on will give them an eye opener that these guys should be involved, and then they will learn from colleagues across. So what do you plan to do to help the movement grow? So one way for me to help the movement grow is by making sure that the current project I'm implementing, which is improving data management and reporting at facility level, that can actually help me to really make the movement grow. Because at national level currently, if these guys are seeing what I'm doing, it will give them that particular opportunity that it is good for them to participate. And I can tell you from colleagues whom I have actually learned from, these guys have been exceptional. So I think these are the ways I really want to make sure that the movements grow and see how best we can actually be together. Over. Thank you.
Thank you very much indeed. That's it feels like we've just started our way across the river, and we're still finding our way. But it's been 16 weeks. There's one more task, as I said, for those of you who wish to earn certification for the Impact Accelerator. For those of you who have done an action plan, you'll be receiving an update, a certification update about that. For those of you who haven't done an action plan yet, but would like to, you still can, and you have until August 27th to do it. For those of you who are interested in becoming country focal points, regional focal points, helping to coordinate and guide this movement, you'll be hearing very soon or in the coming weeks about what the next steps are. And then for those of you who wish to become co-authors of some of the knowledge products that our Insights unit is working on, we'll be sharing the full video from Friday as well as additional information in the coming days and weeks. And then here's a recap of the upcoming milestones. So that's it for this 14th and final assembly of the first full learning cycle of Immunization Agenda 2030. But this is just the beginning of the movement. And the people who are here in this room with us in the Zoom studio, you have the potential to lead, to continue to lead, nurture, and grow this movement as we are just getting started. There's so many of you still in the room just sharing out the links. There are very few likes. Very few people are sharing the incredible photos that are showing the work that you do every day. So please go to your colleagues, go to the Instagram account if you use Instagram, and if you want to stay up to date I recommend you subscribe to the YouTube channel if you have poor connectivity. Subscribe to the podcast. Those are some of the things that are easy to do and that can help you make a difference. Thank you.